Welcome to the Elevating Aesthetics podcast. I'm Brittany Perez.
And I'm Courtney Burke.
And today we're going to talk about the value in an aesthetic assistant and what is trending right now in aesthetics.
Yeah, so I am one of the MAs here. I have been with Brittany for about 3.5-ish years. I came into this role knowing absolutely nothing. I had my degree in general education, and that was about it. So I kind of learned how Brittany likes to do everything by exactly how you taught me. I just watched and I learned, and I was a sponge, and I listened whenever you consulted. I listened when reps came by. I just took in all the information. And then I fell in love with aesthetics, and I fell in love with being a medical assistant. And I don't ever want to have a different job.
I was so nervous to have an assistant, and I put it off for so long because it is my reputation and my license on the line. And so to have someone that is, drawing up medications and doing all the things that Courtney does, it was a little stressful for me in the beginning. But honestly, after working with her for a few weeks, I was like, you got this. I completely trusted her. And I think that that's really rare. So I think most aesthetic assistants that are hired, they definitely need a training program, which is why Courtney is working on a training program for Method, because it's needed. It's not every day that you have someone that steps into an aesthetic clinic and they just catch on. But it can be done, and it adds so much value to my practice because I don't have time to do everything. And I am type A and I like things a certain way. And if you slow down and take the time to train someone, it can really elevate your practice because you have time to do more of the business things and let your assistant help you with what they can. And really, Courtney helps me with more than you would even imagine. There's a whole list of things, and she's added an incredible amount of value to my practice. And I couldn't imagine functioning now without you.
I couldn't imagine you functioning without me.
I can't. I tell patients all the time, honestly, Courtney does like 85% of the work and of my job because she gets the patients back, she takes their photos, she consults them, she puts the numbing cream on, she does the dental blocks, she does my microneedling, my chemical peels, she gets their after photos, she goes and grabs them brochures, she gives them their post-care instructions, their post-care kits. I'm like, I just walk in and I'm like,
I hand you stuff.
She hands me all the things. She makes suggestions. She's like, hey, this patient's here for this. I think they would benefit from this. So I talk to them about these options, and she's already like set the trajectory of their treatment plan because she knows me so well and she knows what I'm going to do. I'll change up things every once in a while just to keep her on her toes.
Mm-hmm. And I think that's like different between like a regular MA versus an aesthetic assistant, because with aesthetics, you're coming in here trying to help people enhance how they feel, whereas traditional MAs are like medical with, I don't even know what traditional MAs do, but as far as like medications and helping the doctor. But here it's like how you feel about yourself internally, like changing how someone feels about the way that they look or feel about themselves. It's completely different, to learn about skin and to learn about, their goals in life, or, it's therapy too.
It's definitely therapy. Have you seen the TikToks going around where the hairstylists are like, it's $300 without therapy and it's $400 with therapy? And they're like, oh, no therapy, I'm good. And so they put a piece of tape on the person's
That would never
mouth.
happen.
But it is therapeutic, and the things that we do are not just for vanity. It really does help with mental health and confidence. And if you're confident in your appearance, you show it better in life. And we've talked about that before.
Even depression.
Yeah.
Like whenever I had Austin, I went through like postpartum depression. And I'm like, Brittany, I'm not breastfeeding anymore. I need to get on your schedule ASAP. I need something done. I haven't had anything done in about 9 months. And you're like, okay, I know a girl or something like that. And I was on your books like that week. And it does help. It helps your depression. It definitely does for me, for sure.
I think so too.
Just a needle poke alone. Like, you just inject some saline or something, just poke me.
I do find that hiring an actual medical assistant, and in no shade to medical assistants, but I don't think that you actually have to find something. It depends on your state. But in Florida, there's no licensing required for a medical assistant. And that's really valuable to me because medical assistants go to school, kind of what Courtney was alluding to room patients, to pull charts, and to give some medications. And that's fabulous, but they're not going into it because they love aesthetics. And I think the most important thing that you can consider whenever you're hiring an aesthetic assistant is, do they have a passion for the industry? Are they interested in the treatments for themselves? Like, do they love skin? Do they already follow you and they watch what you do and they love you already? I would find way more value in that, no matter what industry that person is coming from, rather than hire someone because they're an MA.
Yeah, like with me not having like any medical degree, I still like will go to conferences, we'll have scientists come in, and I still ask them questions. I'm like, I'm not an injector, but I'm still curious,
Yes.
like what would happen if this were to happen? Just being that sponge and just having questions and being comfortable in asking questions, like just because you're curious and you want to know and want to learn.
Yes.
That is this industry. You're always learning, you're always growing, it's always changing.
Yes.
Always need to stay on top. You go to conferences 4, 5 a year. You know, the industry changes all the time. Aesthetics is only growing. So I think it's important to stay educated and ask questions.
And you have to love it to do that. Like, it has to be a passion. I don't think if you have someone that treats it like a job, they're not going to fulfill an injector's needs, because injectors are so type A by nature that if you have someone that just does the job but they don't love it, it won't work. I think you have to love aesthetics. And to what you're saying with going to conferences, I do think that it's so valuable to bring your assistant with you as much as possible and let them into the trainings and make sure that they're a part of it. Because again, Courtney is the first face that my patient sees, and she's educating them first. She's really doing the consult based on what she knows I'm going to say. And she has to be just as educated as I am on devices, services, skin, all those things. So you can't leave them behind. I think that if you take them with you and let them grow with you, that is the relationship that's going to last long term.
So speaking of like growing and aesthetics is always growing, let's talk about what's in versus what's out.
Okay. What do you think's in? I think exosomes are definitely coming in hot this year, and it's going to continue to grow. We actually just brought on plated, which is really awesome, shelf stable exosomes, which is the first that I've seen. You don't have to have it refrigerated. No smell. Yeah, it has no smell. Some of them smell like potatoes, or a little bit interesting, but I think exosomes for sure. Definitely biostimulation. What do you think?
And PRF.
Yeah. PRF is definitely growing as well.
More like rejuvenation.
Yes.
We do HA like in the lips and stuff, but most of our patients are like, I don't want a Band-Aid. I want you to fix my skin. I want you to stimulate my collagen.
Yes.
That's what's in collagen stimulation.
Unless they're getting married, their son's getting married, and they want instant gratification. But even in those cases, I will do the biostimulator first and then have them come back a couple of weeks later and add a little bit of filler in the meantime while the biostimulator is kicking in, and give them like a little bit of a quick fix. But I agree with you.
RF microneedling.
Yes.
Lasers.
Jinx.
Moxie. BBL. That's growing, baby. That's on the trend.
We're about to be lighting everybody up. I had Moxie recently and I'm obsessed with it. I had one treatment and it was significant. And even me looking in the mirror every day, which is why we take before photos, I was like, it looks good. Like my skin, my pores are definitely smaller. My makeup is going on smoother. And then when I did the video side by side, I was like, shoot.
And she already has like the best skin. I can't even, like, her skin getting better makes me sick. Not fair.
What else? What else is going to be on the up and up? Okay, so
weight loss.
Yeah, so that's what I was going to say. Peptides are definitely, they've been growing for the past few years. But in addition to weight loss peptides like the GLP-1, semaglutide, tirzepatide, other peptides, like I was just reading about BP157, which is good for
what? Which you just sound like a robot. Beep, beep, beep.
Which is good for hair and a few other things. But hair is one of the primary things that I thought was really interesting. We're going to have Brittany come on, Toxic by Brittany, because she does tons of peptides. We're going to have her on soon.
I need to be more educated on peptides, to be honest.
Yeah, and we'll get more education from her. We should go see her.
Yeah.
In addition to that, gut health, holistic health, functional medicine. We have Brooke now that works at Mila, and she's going to be working more on the functional side with hormones, because whenever we think about health in general, or we want our skin to look better and we want our skin to be tighter, estrogen, progesterone, and testosterone are a huge component of that. And if we are unbalanced, which is so common these days, then we can't be our best. We can't feel our best. We can't look our best.
Absolutely.
So I think a growing trend in general well-being.
Yeah.
And even I am looking more into NAD because that is really good for brain health and overall like neurotransmitter function. So I think that is going to continue growing. Anything in the general well-being category.
Mm-hmm. Yeah. I like, with me being, acne prone, a lot of it is because of what I eat and my hormones. I just had a dang fruit roll up that probably has so much bad stuff.
Red dye.
But it's good in the moment. But that is something, that is my goal, is to get better on my gut health, like probiotics. I'm going to do the semaglutide, whatever it is, for inflammation.
Do you take probiotics right now?
Mm-mm.
I need to find some good ones too. I've heard good things about Pure Encapsulation, and I was looking at another brand. I like liquid probiotics.
Yeah. The pill gets stuck in my throat.
We need to go to the health food store and look at the liquid probiotics.
But it's just like, it's so important. Your gut controls so much.
Yep.
Your gut controls so dang much. It controls like how you think mentally.
Your immune system.
Yes, it controls how you feel.
Because when your stomach hurts, think about how moody you are. So if you have anything that's imbalance in your gut, it does affect the way that you show up in life. It does affect the way that you feel. It can make you grouchy.
It can make you tired.
It can make you lethargic. So I feel like hormones, gut health, holistic, general well-being, is the future.
1,000% for sure.
If you have any questions about how to hire an aesthetic assistant, we are happy to answer those questions in our DMs, and we will continue working on the aesthetic assistant program through Method, and we will let you all know as soon as it's ready to be released.
It's going to be good.
Yes.
So follow along. We are going to be having a couple of guests coming on our show. One of our guests is going to be Brittany, and we're super excited to have Brittany Squared in the building. She's not going to be in the building, but she's going to be on our podcast. Yeah, Zoom. And I'm going to have a Brittany sandwich.
Yes.
I love her.
I love her too. And then in a couple of weeks, we are going to have Cartessa on, and they're going to talk to us about all of the resurfacing lasers and all the science behind it. So we will talk to you guys soon.
Bye.
Bye.